Doctor, my next question is, at what level the care of the baby should be started?
Yeah. The care of the baby starts in the womb once the mother, she is pregnant and the pregnancy is confirmed, because most of the development and growth of the organs of the baby is completed within 12 weeks. And the heart and brain, the primary portion, is completed even before she realizes she is pregnant. So the care of a baby should start with your pregnancy. So the first 12 weeks is very important for the growth, and the complete organs are grown by 12 weeks. That is called the first trimester. During the second trimester, which is the next 3 months, there is increase in size of all the organs which is formed, like the brain, the heart, the kidney, and most of them, they start functioning on their own. That is the second trimester. And the third trimester is only increase in the physical and somatic growth of the baby, so that they come up to a normal weight of what is expected at completed 40 weeks of pregnancy. So your care of a baby just doesn't start as soon as the baby is born, but at the time when pregnancy is conceived. So mother should be very healthy during her first 3 months. She should not get fever, she should not get cold, she should not take any unnecessary medications, because any insult in the first 3 months will interfere with the formation of organs of a baby, which is very crucial. Formation of a brain, formation of a heart, formation of a kidney, and all those problems. So the first 3 months, once she is very careful, then the next 3 months is only increase in size and function. But during these 3 months, the mother is prone to get lot of ailments because of pregnancy per se. The pregnancy per se can induce hypertension. Pregnancy per se, she may become a diabetic, and so many problems can occur. So at that time, during the 20 weeks, we have to get a good scan of the baby. This scan of the baby will show whether all the organs are formed normally. This baby, is it likely to have any congenital defect, birth defect or not? Because you can't abort a baby after 20 weeks of life. Medical termination does not allow. This scan is very, very crucial. If there are any life-threatening or a major morbidity, birth defect in the baby, you have to sit with the parents, the family, counsel them. If this pregnancy is allowed to continue, what they will expect. Will the baby have a normal life? Will the baby have some major treatment like surgery? If treated, what will be the outcome? And if it is a life-threatening problem, you can give the option of terminating pregnancy by 20 weeks. So that is why the second trimester is very, very important. During that time, the mother should also be monitored for her BP, for her anemia status, for her sugar levels, and of course, the growth of the baby should also be monitored. So majority of the things are completed by second trimester, which is 24 to 25 weeks. So after 25 weeks, a baby just matures and grows and increases in weight. During this time, we have to have a very good concentration on maternal nutrition, because by any chance the baby's growth is not very well during a second trimester or so. During a third trimester, if she takes a very good nutrition, it can catch up and the weight can gain, the baby can grow, the length can grow and all that. So we have to concentrate on monitoring the mother's health status as well as on her nutrition status during the third trimester. What happens is, when the mother is working, when the mother is very stressed, there is a high likelihood of mother going into labor and delivering a baby in the third trimester, which is called as prematurity. A normal pregnancy duration is 40 weeks. If the mother by any chance delivers before 37 weeks, it is called as prematurity. Especially nowadays, lot of artificial conception has started, in vitro fertilization, that is the test tube babies. So many things are happening. These babies, they are at higher risk of premature delivery. Sometimes they are twins, sometimes they are triplets. So we do not expect them, when there is multiple pregnancy, for them to achieve 40 weeks of pregnancy. These babies are born much earlier. Or if the mother has some bleeding during the third trimester, she may deliver the baby much sooner. So these are the area where we have to concentrate on the maternal care. If any of these issues are there, definitely a neonatologist will be called by the obstetrician who takes care of the mother, and these issues will be discussed so that we are prepared what baby to be delivered. Sometimes we also discuss on when to deliver the baby, how optimal. No, we have to tell. Suppose mother has got uncontrolled BP, we have to imminently deliver the baby. Otherwise, the baby is not going to thrive well inside the womb. So at that point of time, the obstetrician will also consult us, because is it worth delivering a 25 weeks baby who's only 600 gram? Will he survive? Will he be normal? What is the cost of care? How long he has to be hospitalized? So we will say, when 28 weeks is completed, we can give a decent, good outcome for the baby. So we try to discuss the pros and cons with the family and decide which is the optimal time to deliver.